be starting chapter 1 of phlebotomy, um, starting with the practices and the quality assessment. Right, things that will be covered in this chapter. Upon completion of this chapter, you will be able to define phlebotomy and identify health professionals who perform the phlebotomy procedure, identify the importance of phlebotomy procedures to the overall care of the patient, list professional competencies for phlebotomists, the role in delivering, collecting, and or transporting specimens, the, lab- the laboratory and key elements of a performance assessment, describe the clinical laboratory workflow, pathway, or testing cycle from beginning laboratory requests to reporting laboratory test results. Explain components of professionalism and desired character traits for phlebotomists. Describe coping skills that are used to reduce stress in the workplace. List the basic tools used in quality improvement activities and give examples of how a phlebotomist can participate in quality improvement activities. Define the difference between quality improvement and quality control procedures. Okay. So to begin, clinical decisions are based on standards of practice, which you'll hear often referred to the SOPs, depending on where you work. Diagnostic testing, laboratory testing, x-rays, and etc. Patient's history, observation of signs and symptoms. And you'll see as we're going through this, everything is you're going to hear some things that you've heard before, because repetition is the father of learning. Just want to continue to reiterate like how important it is to make sure that you follow the guidelines outlined in the SOPs, doing making sure you have certain things such as the patient's history, and knowing what to look for and observing what's going on with that patient and with your current patient, as well as all patients that you interact with throughout your the duration of you working. Okay, because the more that you're engaged, the more people you interact with, the more that you're going to learn. Okay? So just be mindful that you should always keep your head on the swivel, keep a keen eye, and pay attention to details. Okay, the definition of phlebotomy derived from the Greek word phlebo, which relates to veins, and tonomy, which relates to cutting. Synonyms words are venesection and venesection, venesection or venesection. Definition can be summarized as the incision of a vein for collecting a blood sample for laboratory testing or therapeutic purposes. The blood sample removed should be small enough so as not to cause harm. So the most common phlebotomy techniques are venipuncture. It's blood sample from a vein, not an artery, using a needle attached to a collection device. Skin, dermal, or capillary puncture, superficial skin puncture, typically in the finger, to withdraw small amounts of capillary blood. How are laboratory test results used in clinical decisions? Diagnostics and screening tests. Okay, are the abnormalities affecting the patient or irregularities that require follow-up or testing. Therapeutic assessments to develop appropriate therapy or treatment of medical conditions. How are laboratory test results used in clinical decisions? Monitoring. Is the treatment or therapy effective? That's what we're trying to do when we're going through these things. Any any treatment that we give, again, just being mindful, monitoring, watching, watching for those symptoms to see if the course of treatment is effective. If it's not effective, catch it. If you catch it early enough, we can change it. Hopefully reverse the effects that the initial treatment had, and be able to assist that patient and get them back on the right track. Phlebotomy practices. Duties vary in scope of range, can involve clinical, technical, or clerical functions. Settings range from inside laboratory to hospital, clinics, point of care, home health care, ambulance, and remote places. Now you want to see box 1 in the textbook. All right. To touch on box 1, which is the potential job sites for phlebotomists and clinical and medical assistants, we have the hospital, which is the inpatient setting. It's acute care hospitals, specialty hospitals, where we have the specialty hospitals. They tend to care for cancer and psychiatric long-term care, pediatrics, ambulatory care, health department clinics, community health care centers, rural health clinics, community-based mental health centers, school-based clinics, prison health clinics, dialysis centers, screening centers, home health agencies, home hospice agencies, durable medical equipment suppliers, emergency care centers. Um, we have hospital-based clinics, hospital-based emergency centers, health maintenance organizations, insurance companies, physician group practices, individuals or solo medical practices, specialty practices, rehabilitation centers, mobile vans for blood donations, mobile vans for primary care delivery, mobile mammogram units, freestanding surgical centers, reference laboratory collection sites, drug screening sites, field hospitals and clinics, fertility clinics, and pharmacy clinics. Okay. Going forward, when when you're done and you're looking for a job, again, you guys have heard me say it before, don't just limit yourself to the job postings that you see on Indeed, because again, a lot of places will not post their jobs on Indeed because it does cost a company a lot of money. And depending on the time, that may not be in the budget for that company to do so, or they may be in a transitional phase where the person that does that isn't there, maybe on vacation, probably quit, whatever the case may be. So this is a list. You have a list here in your book, in box 1, on page 4, of other places that you can look for to seek employment. Okay? Again, keep in mind when you guys come in to do your mic interviews with me, you are required to bring me a list of at least 10 places that you want to apply. Okay? So just be mindful of that. Healthcare settings and healthcare teams. Know the members of the healthcare team. Learn the specialty and subspecialty areas of hospital care, of healthcare, and medicine. Learn about other healthcare professionals and their roles and responsibilities. Learn about all areas of the clinical laboratory and their functions. All right. And if you look at table one, I'm not going to read this one because there is a lot of information on this table. But again, it just breaks down the different areas or the specialties and what it is they do. Okay. Become a professional and mature member of the healthcare team. Understand the mission of the organization, goals of the group, and projected objectives. Know the skills of team dynamics, active listening, group norms, etc. Understand the relevance and commitment to team goals. All right. To sum this up again, just further iterates what some of the things that I talk about from the career service standpoint when we're in the effectiveness of conducting or performing an effective job search. You don't want to say that you want to go work at some place just because they make a lot of money and the hours good or your friends work there, whatever the case may be. Um, because if money is the motive, then you're not going to be happy. Okay. I mean, obviously, money is the motive. Everyone wants to be in a position where they make enough money to where they can live comfortably. However, if on the back end you have to put up with a tremendous amount of unnecessary hoopla, at the end of the day, is the money really, really worth it? Okay? So I speak about the importance of doing the research on the company, knowing the company's mission statement. How does that company's mission statement align with your own morals and principles? Okay? Talk about that the importance of when you're getting ready to apply for a job with a company or you're offered a job or you're about to have it or you're offered an interview, the importance of mapping out the best route from your from from home to this place if this is somewhere you're going to work, taking into account traffic, if you have kids and you need to do XYZ with them before going to work or after work, like what is going to be the most effective route, what time would you need to set your alarm to ensure that you're at work on time, so on and so forth. And we also want to go in and get a feel for the place. Okay, again, it may be a great place to work because the money's good, you have friends there. But if you go in and you see, especially with a time with what we're going through right now, this whole COVID-19 thing, and everyone is freaking out. If you go into a place and it's just not clean, or they're not offering the patients the best care possible, or they're doing things that are out of that are not in compliance with OSHA and HIPAA, again, is there somewhere that you want to work? Because even though the money's good, it's close to the house, they let you off anytime you want, but if they're not in compliance, and in the event that, hey, some people from state walk in, the auditors, hey, they do reserve the right to shut your job down, and just like that, you're out of a job. You're not working until they make personnel changes and conduct formal investigations and things of that nature. Yeah, I've been there, seen that firsthand. People come in and just shut everything down. Right? So you just want to be mindful of that. Okay. And what are the people in here like? If the receptionist has an attitude and the receptionist is the first person that they see, that the patient see when they walk in the door, yeah, pretty much you can bet your bottom dollar that the rest of the staff is going to be like that. Okay, because again, with that receptionist being the face of the business, they're setting the tone. They've interacted with somebody, enough people on every level for everyone to know that this how that person is, and if the head person allows that person to continue to act like that, then they don't see a problem with it, and that negative energy is just going to trickle from the front to the back and all over the building. Okay, so again, so be mindful of these things. Take all these things into consideration when we're looking for a job. Show reliability and dependability in work assignments. Actively communicate your ideas and respectfully participate in decisions. Learn to be flexible. Constructively manage conflicts. Okay, again, just showing that you're reliable and dependable. You are offered a job and you are asked to work 8 to 5. You need to make sure that you're there at least 7:55, and you work till 5. Okay, are you reliable or are you dependable? You can't be calling in and out all the time. Oh, I'm sick. Oh, Susan has a dance recital. Whatever the case may be. It may be cool every now and again. You could possibly get away with it, but eventually, that's going to add up. All right. So you say you're going to do something, please, please do it. And it's not just in your work life. This is in life. Period. Be reliable and dependable. Okay, and these are things that you can have, that you can add to your resume, but you also want to make sure that these are characteristics and skills that you exhibit. Okay, if you have an idea about something, or you see that something is not right, respect the chain of command and follow up with what's going on. Okay, being being resourceful is another great skill to have on. Resourceful and efficient are great skills to add to your resume. Because at the end of the day, everyone is trying to make money. Okay, so if you know something that could save me money or help me make some more money, guess what? My door is always open. Okay, play a part in the decisions that are being made around there. Because again, that's just going to show that, hey, that you're reliable and you're dependable. You don't want to be a yes man. Okay, let's get to the point where people just stop including you on decisions because you've already laid the narrative that you're just going to go with whatever. All right, and then that ties into learning how to be flexible. Um, if a new policy is implemented, or someone asks you to do something, do it. Because again, it's only going to be a learning experience. Everything is a learning experience. You'll learn that this works, or that, hey, this doesn't work for you. Okay, so, and there's knowledge that you can take on to another job in the event that you have to go find another job, or you want to go find another job. All right, you have to be open to criticism, and you have to be willing to manage conflicts. Okay. Oh, I had this attitude all my life and I don't play. Yeah, okay, that's great if that's how you choose to live your life. But I promise you, that's not great. All right. Stop, take a step back, take a couple deep breaths, and see how the conflict can be resolved. Right? I understand it's easier said than done, but hey, you have to start somewhere. Okay? And again, this is not just synonymous to work. This, you transfer this over to life. contribute to the cohesion of the team, contribute to problem solving strategies, support and encourage other team members. Again, just elaborating on what I just said about the decision making and problem solving, having that narrative or having the mindset that, hey, it's not my job. That's only going to get you so far. Again, being reliable, independent, um, dependable. All these things tie into that. If you see a coworker who is in a awkward situation and you can offer them some assistance, please do so. Okay. If you see them doing something out of compliance, find out why they are doing it. Maybe they have just been taught wrong, and explain to them why that isn't the best way to do it, and show them how to do it. Can't just don't just go catch an attitude and, well, you doing it wrong. No, that's not. People don't respond to that. You think about it, you wouldn't respond to someone in a positive manner if they approached you like that. Okay, so why would you think that someone else would respond positive to that? Clinical laboratory and specimen collection services, clinical pathology, blood and other types of body fluids and tissues are analyzed. Examples include blood, urine, um, cerebrospinal fluid, septum, gastric secretion, and synovial fluid. All right. Amniotic pathology, autopsies are performed. Histologic and cytologic procedures are performed on tissue and fluid specimens. Fine needle, um, aspirates, and surgical biopsies are analyzed. Right, it just goes to show, talking about the pre-exam process, the examination process, and the post-examination process. All these things are highly important to the overall success and treatment of a patient. Again, knowing about monitoring the signs, making sure that the treatment is effective, and things of that nature. Okay, so all of this, the post exam, the exam, and pre examination, are all important. Okay, um, pre exam is just as important as the post exam, because if the patient comes in and tells you that they're experiencing this, and you notice they're doing something else, which is a symptom of another illness or disorder, um, and these are things that you just take into consideration. So you document in that chart, ask them about it to get some more information on it. So going forward, we can make the best, we can find the best line of treatment for them. Agencies that oversee clinical laboratories, you have the FDA, you have the CMS, Clinical Laboratory Improvement Amendments, just clear. You have OSHA, Department of Transportation, the International Association of Blood Banks, American Society for Clinical Pathologies, College of American Pathologists, Joint Commission, a credentialing agency involved in certifying licensing laboratory personnel. But Just want to make sure you make yourself familiar with each agency's name, so you will know. Because when you're in the healthcare field, you'll hear the analogies or synonyms um, quite often. So we just want to make sure that you be mindful of that. So if you hear someone talking about CAP, you'll know that's the College of American Pathologists. Right? Clinical medical laboratory departments, administrative offices, supervisor and management personnel, physicians or scientists overseeing specific areas of the clinical laboratory, technical experts and staff performing tests and reporting results. Um, Clinical medical laboratory personnel characteristics: like to solve problems, strive for accuracy and reliability, and their job tasks communicate well. And so this is the field that we're choosing to go in. So ask yourself, are you someone that likes to solve problems? Do you strive for accuracy? Like everything has to be done right. How well do you communicate with people? Right? Working under pressure, following through on complex tasks. You set high quality standards for themselves and their work. And all these things that you should be asking yourself. Phlebotomy education certification, high school diploma or equivalent is required to obtain the certification. Length of training ranges from a few weeks to months. Pass a national certification exam. Okay? Attending continuing education programs online through colleges and universities and or at professional conferences. Okay, and if you look at table 1, 2, and box 1, 6, you believe they give you some of these. Um, so table 1, 2 breaks down the board of certification and phlebotomy, tells you what each exam is and what portion of the exam is for each topic. Okay. And box 1, 6, the typical clinical, technical, and clerical duties and attributes of a phlebotomist. It tells you everything that you will be required to do in the event that you want to apply for a clerical position, which is receptionist work, to say the least. Okay. Professionalism: the skill, competence, and character expected of an individual in a trained profession. Okay? We see here: respect, support, service, and growth. Competencies, certifications, and professionalism for phlebotomists. Professional organization for phlebotomists. You have the American Society for Clinical Laboratory Sciences, American Society for Clinical Pathology, National Phlebotomy Association, National Healthcare Association. Ethical standards for phlebotomy: do no harm intentionally, perform according to sound technical ability and good judgment, respects patients' rights, confidentiality and privacy, right to know about the treatment, and right to refuse treatment. Okay, see box 7.1 in the text. All right. Character traits for phlebotomists: sincerity and compassion, emotional stable and maturity, accountability for doing things right. Um, all right. Um, Sincerity and compassion. See this a great deal. People are not sincere when it comes to work. People just typically see a job as just a job. Okay, it is what pays the bills. Everyone always say, "Oh, I chose the medical field because I like to help people. It's something I always wanted to do." But then you catch them when you see them at work. They're by far the most aggravated people in the entire world. And there's a couple different things that go into that. Maybe they're just having a bad day, or it could be on the back end, worst end, how I spoke about the finding the best fit for work. They may not be happy there. They may be in a position where they make really good money, but they don't like the people they work with. They don't like the environment that they're working in. Right, and that spills over into their personal life. They got to bring that home with them. That's causing all type of problem. Now you're mentally unstable. You got all this bad energy around you. All right, so we don't want that. We want to make sure that we can want to eradicate all that if we possibly can. And so that now we at, because you don't want to make sure that you're emotionally stable um, at all times. Maturity. Maturity comes with age and experience. Well, more so experiences. You can be a certain age, and that doesn't imply that you would be mature. Maturity comes from what you have endured, what you've experienced and learned, the lessons that you have learned from things that you have been through. Right. So again, taking that and being able to put that to good use to further assist someone or a group of people. All right, knowing when is a time to talk, when there's a time for action, respecting authority. All this falls under maturity. Okay, um, accountability for doing what's right. Again, this is really important. It doesn't matter if everyone else in the building is doing it wrong. You should do it right for the benefit of you. Right? It doesn't matter what James, John, Susan, and Karen doing. You follow the rules. All right, you do what's right. Dedication to high standards of performance and precision, respect for patients' dignity, privacy, confidentiality, and the right to know. Purposes for cleanliness. And you just want to make sure that you're clean, using the right cleaning supplies, and just knowing the what what's going on. Again, like with everything right now with the pandemic, people are, in my opinion, I don't feel as though that they're going about things the right way, because people are just going out buying up all the hand sanitizer, over sanitizing their hands and not washing their hands. Um, the rule of thumb for every 3 to 5 times that you sanitize, you should be washing your hands. And people aren't doing that. They're just sanitizing, breaking down their their defenses. Okay, using Clorox wipes. Things clearly state that you shouldn't touch them with your hands, and I see people doing this all the time, just grabbing a Clorox wipe and wiping something down, and then they don't even wash their hands after. Right? Just so you're actually doing more harm than you are doing good. See, people throwing their mask and gloves on the ground. So even if you touch something that had anything on it, AIDS, whatever the case may be, you didn't touch yourself with it. You got rid of the gloves, but you just threw them on the ground, and now this is in the air for more people to come in contact with. Right? It doesn't make any sense. There are no shortcuts when it comes to cleaning. Okay, you have to be thorough when cleaning. Right? And that's in every aspect. You want to make sure that your work area is clean. When you're when you're prepping the patient for any procedure, you want to make sure that you clean the area properly to reduce the risk of infection. Okay. Pride, satisfaction, and self-fulfillment in the job. Work with team members and take pleasure in communicating with patients. Okay. And you have to be able to communicate with people because people come to you there trusting their life and their situation with you because you are the professional. It doesn't matter if it's your first day on the job or if you've been there for 15 years. People will perceive you as being professional. Like you're in this position because somebody believed that you knew what you were doing, so you need to show them that you know what you're doing. Be able to answer their questions. If you can't answer their questions effectively and correctly, don't just go off and start pulling things out of thin air. Seek the right answers. Okay? Because again, you always have to put yourself in the other person's position. Okay? Would you want someone who in the present moment that you're entrusting your life with to just tell you anything that they felt sounded good? No, you wouldn't want that. Okay. And teamwork makes the dream work. It doesn't matter if you and this person do not get along. We have a common goal here to provide a service to people. Let's do that. And then we can handle our issues later. And the crazy thing about that is that through working together, to provide a service for the betterment of someone else, people oddly, unknowingly will squash their own beefs. And you won't even have to talk about it. All right? Yeah. Taking pride in what it is that you do. All right? It's a lot easier to take pride in what you do if you like where you work. All right. You say you got into the health field because you want to help people. Let's see that. Okay. It's not just a job to pay bills. No, it might be, but people are still entrusting you with their life. Okay? Just be mindful of that. Okay? Appearance, grooming, physical fitness, posture, grooming, personal hygiene, PPE, and your dress code. Your posture is very, very, very important. If I have spoke to you all about the importance of nonverbal communication versus verbal communication, um, nonverbal communication makes up 90, like 95 to 97% of communication. All right. So you want to make sure that you're sending the correct message from the way you present yourself before you even open your mouth to begin to speak. Okay. The same thing on the listening end. You don't want to be sitting there with your arms crossed, rolling your eyes on your phone and things of that nature, because that tells the person that whether they are talking to you or listening to you, that hey, this person doesn't know what they're talking about. They don't seem too interested. So hey, why should I pay them any mind? Grooming and personal hygiene. All right. Natural hair, great. You're embracing who you are. It's great. I respect that. I can get behind that. But again, keep in mind that this is bigger than you. All right? You're going to be dealing with people that may not like your natural hair. So let's take care of that. All right. Making sure your hair is the right color. You want to go in with rainbow colored hair. Kids may love it, but the parents or grandparents, who's ever there with the kid at the time, if we're working in peds, they may perceive that as being highly unprofessional. All right, so let's not do it. Okay, you smell you before anyone else. Okay, it's amazing what you get used to. So if you're not a person that just bathes frequently, or you feel as though that little body wash that you get from the dollar store works, you know, be mindful of that if someone comes to you and say, "Hey, are you all right?" Wash your clothes. Make sure they are ironed. Because again, people are looking at all of this stuff. I'm the lead physician in a building, and a patient comes to me and tells me that, hey, one of my employees had an odor. They looked unprofessional because the scrubs were wrinkled, faded, had holes in them. The customer's paying me. The patient's paying me, and I'm paying you. Now, if they tell me that they felt uncomfortable and they're going to go somewhere else, that's money out of my pocket, and that's a problem. Again, the objective is to make money. Right now, you're costing me money. So, hey, you find yourself in a situation where we're going to have a good old sit down. Hey, I regret to inform you that we decided to go in another direction with this position. All right. So to save yourself that, just please handle your business. Make sure you're groomed properly, your haircuts, your eyebrows done. Make sure that your nails are not too long. Okay. Again, I get it. It's cute, but again, working in healthcare is not. See these gloves, they're not that durable. You gotta put a glove on and your nail pokes through. That's not good. It's not good at all. Um, so please, just be please, 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 please take all these things into consideration. Make sure you're in compliance with the dress code. And you guys, um, this is why we enforce that you wear white shoes. Make sure that you have your name badge on. All these things are safety for safety reasons to ensure that you are safe at all times. And if you can't do it in preparation for your career, how can we expect you to do it when you're in your career? Oh, it's just school and it starts here. Okay, white lab coats, your scrubs, white shoes, name tags on and visible, show up ready to work.